5 warning signs of poor brain circulation you should never ignore after 60. Have you ever wondered whether a sudden change in your memory, balance, vision, or speech is simply part of getting older, or whether your brain is trying to warn you that something is wrong? After 60, some changes can be normal, but certain symptoms should never be brushed off as just aging. Because when blood flow to the brain is interrupted, even for a short time, every minute can matter. I'm Dr. Sean, and as a director focused on helping people understand their health before a small warning becomes a major problem, today I want to walk you through 5 warning signs that may indicate a serious problem with blood flow to the brain. And stay with me until number 4, because that symptom can be one of the clearest emergency warning signs. Let me start with a story. A woman I'll call Margaret came to see me after her family noticed something unusual. She was in her 60s and had always been independent, but one morning, she suddenly had difficulty finding the right words. At first, she laughed it off. She thought, maybe I'm just tired. Then she noticed that one side of her body felt weaker and her balance wasn't quite right. Thankfully, her family didn't wait. They recognized that this wasn't something to simply watch at home. She was evaluated quickly, and the doctors discovered that she had experienced a transient ischemic attack, or TIA, sometimes called a mini stroke. The symptoms improved, but that improvement didn't mean the danger was gone. It was a warning. And that experience is why I always tell my patients, don't ignore sudden neurological changes simply because you're getting older. Now let's talk about the 5 signs. Number 1, sudden confusion or trouble thinking. Occasionally, forgetting someone's name or walking into a room and forgetting why you went there can happen to anyone. But sudden confusion is different. If a person suddenly becomes disoriented, has difficulty understanding what's happening, struggles to follow simple instructions, or seems noticeably different from their normal self, it can be a warning sign that something is affecting the brain. The important word here is sudden. A gradual change over months is different from a dramatic change that happens within minutes or hours. If sudden confusion appears alongside weakness, speech problems, vision changes, or difficulty walking, treat it as an emergency. Number 2, sudden dizziness or trouble walking. Balance depends on several parts of your nervous system working together. Your brain, inner ear, eyes, muscles, and nerves all help you stay upright. So when someone suddenly becomes extremely dizzy, loses coordination, has difficulty walking, or feels as though the room is spinning, don't automatically assume it's simply old age. There are many possible causes of dizziness, and not all of them are related to brain circulation. But sudden, severe dizziness, combined with other neurological symptoms, deserves urgent medical attention, especially if there is new weakness, speech difficulty, vision changes, severe imbalance, or confusion. Number 3, sudden changes in vision. Your eyes may be healthy, but vision also depends on the brain receiving and processing information correctly. That's why sudden vision changes can be important. Watch for sudden blurred vision, double vision, loss of vision in one or both eyes, or a sudden change in your ability to see normally. Again, this doesn't automatically mean you've had a stroke. There are many possible causes, but sudden vision loss or a major sudden change should never be ignored, particularly when it happens together with other warning signs. Number 4, sudden weakness or numbness, especially on one side. This is one of the signs I want you to remember. Imagine waking up and suddenly noticing that one arm feels weak, or one side of your face looks different when you smile, or one leg suddenly feels numb or difficult to control. These symptoms can be signs of a stroke. A simple way to remember some of the classic warning signs is FAST, F, face. Does one side of the face droop? A, arms. Is one arm weak or drifting downward? S, speech. Is speech slurred, strange, or difficult to understand? T, time. If these symptoms appear suddenly, it's time to seek emergency medical help immediately. Don't wait to see whether it gets better. Don't drive yourself. And don't assume that because the symptoms disappear, everything is fine. A TIA can produce stroke-like symptoms that disappear, but it can be an important warning that a larger stroke could follow. Number 5, sudden trouble speaking or understanding. Have you ever known exactly what you wanted to say, but temporarily couldn't remember a word? That can happen normally. But suddenly, being unable to speak clearly, struggling to understand simple sentences, saying words that don't make sense, or being unable to communicate normally is different. When this happens suddenly, it can be a sign that the areas of the brain responsible for language are being affected. And again, timing matters. The faster someone with possible stroke symptoms receives appropriate medical evaluation, the better the chance of receiving treatments that may reduce brain damage. So, what can you do to protect your brain? Here's the good news. You can't control every risk factor, but you can take steps to protect your brain and blood vessels. First, know your blood pressure. High blood pressure often has no obvious symptoms, yet over time it can damage blood vessels throughout the body, including the brain. Second, work with your healthcare professional to manage conditions such as diabetes, high cholesterol, and heart disease when present. Third, don't smoke. Smoking damages blood vessels and increases cardiovascular and stroke risk. Fourth, stay physically active according to your abilities. Regular movement supports cardiovascular health and can help with blood pressure, blood sugar, cholesterol, and overall brain health. And finally, pay attention to sudden changes. Don't try to diagnose yourself from a video. Your job isn't to figure out exactly what's happening. Your job is to recognize when something is abnormal and get help quickly. Let me leave you with this. Aging does not mean you should ignore sudden changes in your body. If you suddenly develop weakness on one side, facial drooping, difficulty speaking, sudden vision loss, severe imbalance, or sudden confusion, don't wait for tomorrow. Seek emergency medical care immediately. Because when it comes to the brain, time is brain. And sometimes, the symptom that seems small today is actually your body's biggest warning. I'm Dr. Sean. Take care of your heart, protect your blood vessels, stay aware of your body, and most importantly, never ignore a sudden change that doesn't feel like you.